Good evening, I'm Adrian Arsenault. Andrew is off. Tonight, I'm coming to you again from my back deck as we all stay home. Still, that's a message not everyone is getting.
Frustrating, it's disappointing, and it's disheartening.
Some snowbirds returning to Canada aren't self-isolating. Now Ottawa is stepping in.
Mandatory quarantine for anyone entering Canada.
I've been out of work for almost 3 weeks.
1 million Canadians have applied and counting. Money is coming, but how long will it take? A desperate situation in New York.
They're overwhelmed, they're scared.
They're creating makeshift morgues and turning to the black market for medical supplies.
As isolated as we are, the best thing we can do is to remind each other that we're not alone.
And if anyone can find hope and humor in this crisis, it's Mark Critch. His uplifting message we all need right now. This is The National. After recommending, asking, then pleading with returning Canadians to self-isolate for 14 days, today the federal government went even further. That request is now a legal requirement. Starting at midnight, people coming back to Canada from anywhere else will be subject to the Quarantine Act. Violate it, and you could be fined or arrested. That's just one major move by Ottawa today. The other, final approvals for a $107 billion aid package for businesses and workers. That, as the number of COVID-19 cases in Canada climbed past 3,400, leaving 9 more people dead. So keeping returning travelers away from everyone else until they're sure they're not sick, well, that's a critical part of the fight against this coronavirus. Catherine Cullen takes us through the brand new rules.
It is extremely important that everyone returning to Canada isolate themselves for 14 days.
No more asking in stern tones. It seems too many Canadians weren't respecting that request, so now it's mandatory.
Today it becomes law. Today it is legally required that when you step off a plane in Canada, you go directly home.
If not, in the most extreme cases for jeopardizing a life, the fine can be up to $1 million or 3 years in prison.
There will be follow-up, there will be random screening, and there will be spot screening based on particular situations.
The move kicks in at midnight, requiring all travelers coming to Canada to self-isolate for 14 days. If you have a vehicle, you can drive to your home, but no taking public transit. People could even wind up doing their 14-day isolation away from home.
For those travelers who are arriving at one of the 4 international airports and connecting, they will be asked to quarantine in place in those cities for 14 days, and we will provide the accommodation and meals for those situations.
One exception, people working in essential services, like truck drivers delivering food from the United States. Some provinces have already been cracking down, like Quebec and Newfoundland and Labrador, where people have been arrested for refusing to stay home. Police in Nova Scotia are telling everyone entering the province to self-isolate.
We haven't issued any tickets, and hopefully we don't have to. But if that's the only option, we may have to go with enforcement.
The Conservatives say given how quickly the virus transmits, this should have been done sooner.
I can't tell you why it wasn't the time yesterday or today.
But now, she says, the government is fully on side with this plan, hoping that all Canadian travelers finally get the message. Don't stop at the grocery store or to see friends. Just go home, the government says, and stay there. Catherine Cullen, CBC News, Ottawa.
Snowbirds in particular are being called out for not following rules when they cross back into Canada. As Chris Glover shows us, some are stopping and shopping before heading home, and that is sparking anger.
Look at that idiot.
This Timmy's drop-off to a snowbird who just returned home to Canada looks excessive.
6 feet. 6 feet. That's only 5.
Funny, but it's the kind of thing officials are asking for. Not this kind of behavior. Lines of RVs are being spotted outside shops in border towns, many believed to be returning from the U.S.
To me, they're either careless or they're completely disconnected with the reality of the situation.
Better options exist, says the Windsor mayor.
So there are plenty of avenues to seek support, and there's no reason you have to go out and try and risk your own safety, your own well-being, and anyone else's well-being to get a bag of milk.
St. Stephen, New Brunswick is the gateway from the U.S. to Atlantic Canada. The mayor worries people are starting to turn on each other.
The whole public shaming, and that's the only tool our citizens see at this point, because we're not taking action physically on the streets, with police.
Police worry any increased enforcement from them would stretch their resources.
What's going on in our community is still the crime that was going on yesterday. There are still people breaking into people's homes.
They're going right into the stores.
All week, leaders have appealed to people's sense of responsibility.
I can't stress it enough. It's unacceptable. If you're coming from the airport, do not, I repeat, do not stop at a store.
You must go directly and immediately to your home.
But some people just aren't listening. In Eastern Ontario, the mayor of Prescott says people are now parking RVs behind grocery stores, hidden from view.
It's frustrating, it's disappointing, and it's disheartening. But I will say it is the minority.
And even when it looks or feels silly, it's never been more important to follow the rules. Chris Glover, CBC News, Toronto.
For many Canadians, the financial stress of this crisis just gets worse every day. But with the beefed-up COVID-19 aid package now passed, the government says more relief is coming than originally promised, and for more Canadians.
The Canada Emergency Response Benefit will provide $2,000 a month for the next 4 months for workers who lose their income as a result of COVID-19. Whether you're full-time, contract, or self-employed, this new benefit will be there for you.
So Canadians can start applying for that new benefit soon, but it will be weeks before they see that money. A hard wait, given the reality many face. Today, Leon's joined WestJet on the growing list of companies to lay off thousands of workers. And a new survey reveals that over a third of Canadians now fear missing rent or a mortgage payment. The aid package is now worth $107 billion to struggling Canadians. That's up from the $82 billion previously announced, all due to skyrocketing demand for help across this country. Salima Shivji looks at the mad scramble to meet it.
A calm outside that belies chaos inside. Call centers inundated as an old system struggles to keep up with demand. Rebecca Zirk and her husband are both stuck at home without pay, wrestling with the EI process.
We're waiting hours on the phone to talk to anybody.
With bills looming.
I'm very concerned about it not being in my hands fast enough, because the concern is I've already been quarantining for almost 3 weeks. I've been out of work for almost 3 weeks.
She is far from alone, and the numbers are staggering. Nearly 1 million Canadians applied for EI just last week. That's more than any other month since the country started keeping track in the middle of the Second World War.
We've already processed 143,000 employment insurance claims.
That's only 15% of the current pile that keeps growing. And so the government is retooling, desperately trying to streamline the application process. They've merged EI and the two relief benefits into only one system, a flat rate of $2,000 a month for everyone, in the hopes that will make it easier to get money out the door fast.
We're targeting the week of April 6th for us to be able to deliver on this for people.
That's when the online link will be live. Don't expect a direct deposit for at least 10 days after that. To get it all done, Service Canada is hiring, and hundreds more civil servants have been redeployed as reinforcements. Speed is key, and mistakes can be fixed later, says this former deputy minister.
They have to actually try to get the money out fast rather than get the money out correct.
That is the goal, to get money out quickly. There are only a few questions in a dramatically simplified application process, and Ottawa says it's ready to adapt if further changes are needed in these unprecedented times. Salima Shivji, CBC News, Ottawa.
So let's turn now to the number of reported cases of COVID-19 in Canada. That number has now topped 3,400. That's an increase of 617 from just last night. 1 week ago today, only 727 cases were counted across the country. Once again, it's Quebec that leads the daily increase, a leap of more than 300. Alberta reports an increase of 61 cases. Newfoundland and Labrador climbed by 32 cases. That's a small number, but it has nearly doubled the total. Remember, these numbers only reflect cases that are known to public health officials. One thing that obscures the full picture is a delay in getting test results. Among those waiting, healthcare workers who are forced to self-isolate because they don't know if they themselves pose a threat. Magda Gabrisalasa looks at that.
I'm on day 9 of self-isolation. Things are pretty cozy in my apartment, hanging out with my 2 cats.
Dr. Kate Trebas is spending more time alone with her cat these days, waiting to hear if she has or had COVID-19.
I developed some upper respiratory symptoms, some chills, sore throat, runny nose.
The family medicine resident has been waiting for her results for 9 days, forced, like many healthcare workers, to stay on the sidelines.
It is frustrating knowing we could be available to help.
In Ontario alone, more than 10,000 people are currently waiting for their results.
We know that how long you wait for your results varies widely.
Today, the Prime Minister said officials are trying to speed things up. Right now, he says 10,000 people are being tested every day. Every step of testing is crucial, says this infectious disease specialist.
1, you have to have the right types of swabs. 2, you have to have the right people who know how to do the swabs properly. 3, you have to get them to a lab. 4, they have to be processed in the lab. And 5, you have to be able to communicate those results back to the patient and also to the provider who's caring for the patient.
Any hiccups along the way could mean delays or other problems. All this as concerns continue to mount about looming shortages of equipment and necessary chemicals.
We're very worried because the clinical supply chain is, for all of their reagents, is really limited.
Jim Woodgett says research labs could help the diagnostic labs with testing. To prove it, he's working with scientists at 4 of Toronto's hospital research labs.
We can change and adopt the procedures and the care and precision that the clinical diagnostic labs do.
Overall, super lucky myself.
Until something changes, people like Dr. Trebas will just have to keep on waiting for results. Magda Gabrisalasa, CBC News, Toronto.
Now, different provinces are using different strategies to manage the virus. Leanne Young is tracking stories from communities across Canada for us.
Adrian, as we've just heard, in Newfoundland and Labrador, cases have almost doubled overnight, and the majority of them all linked to one funeral home.
I want to speak now to those who attended the Calls Funeral Home in St. John's on March 15th, 16th, and 17th. Based on Eastern Health's public health investigation, I am ordering you to stay at home and self-isolate until April 1st.
And in New Brunswick, the province has set up screening checkpoints at its borders, with officials authorized to turn people away. The move comes as another 8 cases were confirmed. Provincial liquor stores remain open, though, but to protect staff and the public, they're now screening everyone, asking about travel history and symptoms. While PEI only has 5 cases, it's expecting more. The province is opening an emergency mini clinic.
It will function similar to an outpatient clinic, which will allow for increased capacity in terms of testing, for instance, and it is meant to be a location to divert people away from acute care who may not need to go to hospital.
Finally, in Nova Scotia, where 17 new cases were confirmed today, Premier Stephen McNeil is concerned about the survival of small businesses and the fishing industry. He'll be speaking to other Atlantic premiers soon about a plan. Adrian?
Thanks, Leanne. In the United States today, another spike in cases, 10,000 more than yesterday, as testing catches up to the severity of the situation on the ground. So confirmed cases have passed 65,000 and more than 900 people have died. The heaviest burden weighs on New York, with about half of the country's total cases in that state and nearly 200 deaths in New York City alone. Some are describing that city as a war zone. And as the CBC's Stephen D'Souza tells us, the worst is unfortunately yet to come.
In New York, a scene reminiscent of 9/11. A makeshift morgue set up outside a hospital, ready for an influx of bodies. New York City is now the epicenter of the American outbreak, with 1/3 of all cases.
1, 2, 3, 4.
That doesn't even include people like Nadia Levy. The Canadian has all the symptoms but couldn't get a test. She worries New York is the canary in the coal mine for the rest of America.
I think it's going to be bad. I think we're going to really need all the help we can get.
Officials are preparing for hospitals to be overrun. They say they need close to 90,000 beds. At a single hospital in Queens, 13 deaths in one day. A healthcare worker herself, Levy says the situation on the front lines is already dire.
They're pissed off a little bit about the lack of supplies. They're overwhelmed. They're scared.
Some have now turned to the black market.
And you see pallets upon pallets of equipments, gowns, N95 masks, Purell hand sanitizers, Clorox wipes. It's insane.
New York Governor Andrew Cuomo says 40,000 retired healthcare workers have volunteered to return to help, and some supplies have arrived.
We do not yet have secured a supply for 3 weeks from now, 4 weeks from now, 5 weeks from now, but we are still shopping.
Cuomo estimates the peak is coming in 3 weeks. Overwhelmed are all those, So like in Italy, New York hospitals are preparing to make the difficult decision. Who gets life-saving treatment and who doesn't?
There is discussion about, there are ethics discussions that are ongoing, but we are not at that point now.
The fear is that point is not far away. Stephen D'Souza, CBC News, Toronto.
Washington, D.C. is closing all non-essential businesses tonight, and on Capitol Hill, days of heated discussions may finally have resulted in an agreement for an economic aid package. It is the biggest in U.S. history. Paul Hunter has the details.
Well, who'd have thought this? Stored away somewhere inside the giant National Cathedral in Washington, thousands of protective masks now donated to medical workers elsewhere, all but overwhelmed by corona. A tiny bit of welcome news amid word of something much bigger.
To the American people, we say, big help, quick help is on the way.
On Capitol Hill tonight, there's confidence that immense $2 trillion aid package will indeed be signed off on this week. With the U.S. economy all but frozen by the crisis, the thinking is that $2 trillion will keep things afloat for 3 months. Said Donald Trump tonight, if the crisis lasts longer, he'll go back to Congress and more money will follow.
If we have to go back, we have to go back. We're going to take care of the American worker. We're going to take care of these companies that fuel this country.
Meanwhile, a potential new U.S. hotspot, with authorities in Louisiana now worried last month's Mardi Gras celebrations may have helped spread the virus before social distancing kicked in. Louisiana was today declared a major disaster area. Back at the White House tonight, Trump also defended his suggestion yesterday that portions of the country could be reopened for business by Easter.
I have had so many people, and they want to practice social distancing, and they want to practice no handshaking. No handshaking. They're not going to walk around hugging and kissing each other in the office when they come back, even though they may feel like it. It's time. People want to get back to work.
That said, when asked, Trump also underlined,
how many deaths are acceptable to me? None. Okay, none, if that's your question.
A decision on easing guidelines that could reopen some of the economy, said Trump, could come soon. A decision not made in haste, nothing rash, maybe next week. Paul Hunter, CBC News, Washington.
They are some of the most vulnerable in this pandemic, Canadians in long-term care homes.
I am not permitted to go in to see my husband. I'm sorry.
Coming up on The National, families locked out and worried about the care inside for their loved ones. And the very real concerns over what could happen if liquor stores are forced to close.
We will see an increase in death if they are closed down.
Plus a message from Mark Critch to a nation in isolation.
You have a chance to be a hero by staying home and letting the real heroes do their job.
But first, as we go to break, the view from above Canada's biggest city. The streets of Toronto eerily but necessarily empty. We're back in 2. We'd like to welcome our viewers joining us in British Columbia now. We're watching several international coronavirus stories tonight. Spain's death toll has just surpassed China's. The country reported 738 deaths overnight, a 27% jump from the day before, bringing the total to more than 3,400. China has roughly 3,200 deaths. This video, released by the Spanish military, shows troops disinfecting seniors' homes and other public spaces. The country is on day 11 of a nationwide lockdown. Spain, now only second to Italy, where more than 7,500 have died. The military is setting up emergency field hospitals because the healthcare system is overwhelmed. This one in Cremona, in the hard-hit region of Lombardy. More than 74,000 people have tested positive for the virus in Italy. The country has been under lockdown for more than 2 weeks, and officials are hoping to find out soon whether the measures will indeed flatten the curve. And police in India are using violence to enforce a nationwide lockdown. Officers in Mumbai are beating people with batons for breaking the rules. Elsewhere, they're handing out push-ups, squats, and other physical punishments. The Prime Minister has ordered the country's 1.3 billion people to stay home for 3 weeks. Now, so far, India has just over 500 cases, but there are fears that could balloon to 1 million by mid-May. Among those hunkering down in India right now, thousands of Canadians, many of them snowbirds, visiting family and friends. Now they're frantic to get out. But as Anita Bath explains, some seem to be losing hope.
Flights have been suspended, so at the moment we have no way of getting out of India.
Rita Anand is desperate to come home, pleading, along with thousands of other Canadians, for help.
My husband is a heart patient and I'm diabetic, so we are on prescribed medicines. We are scared that our medication might run out.
Priyadarshi Bhattacharya flew to Calcutta to be with his ailing father, who has since died, not from coronavirus.
When a parent is so critically ill, it's a tough choice. I just needed to be there. It wasn't something that was really frivolous or non-essential in terms of travel.
Also stuck, Ottawa's Debbie Levine. She feels Canadians in India are being abandoned.
We're frustrated because we hear how the Canadian government is doing everything they can to get Canadians back, and I can tell you that that is not the case right now.
Levine has been calling and emailing the government nonstop.
We actually managed to get a live person, and they advised us to follow tweets and the news.
In a tweet, the Foreign Affairs Minister says, "We are aware the lockdown is making travel difficult for Canadians stranded in India. Officials are working to assess options in a complex situation." More than 15,000 Canadians in India have registered with Global Affairs Canada, but it's not clear how many actually want to come home. Liberal MP Sukh Dhaliwal's mom is among those stranded. Dhaliwal says he too is putting pressure on the Foreign Affairs Minister.
We are trying to get an access to airfield, and I'm certain that once that is opened up, and we will do every effort to bring every Canadian that's out there.
Little comfort for those who remain stuck, with little hope of getting home. Anita Bath, CBC News, Vancouver.
Prince Charles has tested positive for the coronavirus after appearing to take pains to avoid direct contact with people.
Look closely and you can see the Prince of Wales is declining to shake hands this afternoon, but is doing the traditional namaste.
That was Charles's go-to greeting at recent events, his final public appearance just under 2 weeks ago. So Charles's positive test result came late last night after he showed some mild symptoms. He's self-isolating at the Scottish estate Balmoral along with his wife Camilla, who tested negative, by the way. There was concern over whether he might have infected the Queen, but the palace says she is in good health and today released a photo showing her weekly call with the Prime Minister. Next, we look at the concerns and the challenges inside Canada's long-term care homes.
The residents wander in and out of each other's rooms.
What's being done to protect some of the most vulnerable to COVID-19? And the doctors answer your questions, including, should I change my clothes when I get home from work and wash them? But first. This is what treating COVID-19 patients leaves behind. Frontline healthcare workers around the world are sending out selfies, their faces dented, bruised, and raw from hours wearing those critical masks and goggles. And those eyes, those are portraits of exhaustion. From all these workers, impossible to ignore messages for the rest of us. I'm afraid too, says this Italian nurse, but not to go shopping. I'm afraid to go to work. From this doctor in the UK, I feel broken and we're only at the start. I am begging people, please, please do social distancing and self-isolation. And from this healthcare worker, also in Italy, after a 13-hour shift in the ICU, it will pass if we're united. Do not give up. Never. Welcome back. From the beginning, we've heard warnings about COVID-19 outbreaks in long-term care homes. The older population is more vulnerable, especially living in close quarters. Already in Canada, we've seen cases in long-term care homes in at least 4 provinces. In BC alone, there have been 6 separate homes hit by outbreaks. David Common looks at the challenges in keeping residents safe.
There are few places more high risk than Canada's many long-term care homes. More than half the country's deaths linked to COVID-19 occurred in places like this. Most in an outbreak at this BC home, prompting several provinces to lock down facilities, ban visitors, and extra staff paid for by families.
I am not permitted to go in to see my husband. I'm sorry.
People like Margaret Calver worry there just aren't enough staff to properly care for residents like her husband Wayne, who lives on the same floor as someone who tested positive for COVID. She says in regular times there can be just 2 staffers to care for 21 people. Do you have worries about how effectively you can isolate people on a dementia ward, people who may be prone to wandering, how effectively you can do that with just 2 staff?
Almost impossible. The residents wander in and out of each other's rooms. There are interactions between residents, sometimes quite negative with behavior issues. So I'm not sure how they're going to keep the residents in their rooms.
The home says the best possible protocols are in place to protect our residents, and there are efforts to redirect community resources to the home. To limit potential exposure to the virus inside homes, families and private caregivers have been banned. But the effect many worry will be chaos inside homes.
The issue with wandering residents having lockdown units where there aren't enough staff on in order to help quarantine these individuals. You can't lock somebody in their rooms, especially when they have dementia.
The province is racing now to bring in more staff. Care homes, after all, are where risk and need are among the highest. David Common, CBC News, Toronto.
Time now for your questions. Every night on The National, we're devoting time to getting answers from the experts. Obviously, it's still light outside. We recorded this a little earlier this evening. So with me tonight, Dr. Isaac Bogosh, infectious disease specialist at University Health Network, Dr. Janine McCready, an infectious disease physician at Michael Garron Hospital, both in Toronto. So we have tons of great questions. Let's just dive right in here. So the first one is one we get just about every day. Can COVID-19 be transmitted through the handling of mail or a newspaper? Dr. McCready, can we start with you?
Sure. So far, there's no evidence that we've seen that COVID-19 can be transmitted on newspaper or paper, but we don't have all the answers yet. And there was a study from a few days ago saying that potentially the virus can live on cardboard. So what I would suggest is every day we learn more about this virus is that anytime something new that's touched by multiple other people comes into your home, wash your hands.
All right, next one for Dr. Bogosh. Should I change my clothes when I get home from work, and should I wash them?
Oh, that's a tough one. A lot of it really depends on, what you do, what you come into contact with throughout the day, and also sort of personal risk thresholds and perceptions towards risk. Dr. McCready and I work in hospitals. So when I come home from work, I will be changing my clothes and laundering my clothes. I appreciate other people might not be in contact with lots of people or other high contact surfaces throughout the day, and they might choose not to do so. I think if there's any question as to whether or not you were in touch with some high contact or high risk surfaces, it's just an easy thing to do, to change your clothes when you get home and put on some different clothes at home and launder your clothes.
All right, Dr. McCready, we have a question from someone who's clearly picked up on the basics here. So since the virus travels via droplets and is not airborne, how can you get the virus from someone who is close but hasn't sneezed, hasn't coughed, or even touched you?
Oftentimes in our social interactions, even if you're just close to someone, you might inadvertently touch them, or more importantly, touch something that they're going to touch. So for example, if you're chatting with a friend, you might have your cell phone. If you've touched, your nose or your mouth and then touch your cell phone, you might then show them a picture, pass them your phone, and then they'll touch that. And if there is COVID-19 on that phone, then they could touch that and then afterwards touch their mouth or nose and transmit it to themselves. So those things happen, multiple times in every social interaction, and that's one thing that can happen. And so the closer we are to people, the more likely the virus is going to use those opportunities to get from one person to another and continue to spread.
And so, Dr. Bogosh, can you jump in there?
Yeah, absolutely. I mean, as disgusting as it might sound, even though if someone's not coughing or sneezing, we're still unintentionally spitting and getting little bits of saliva out of our mouths and into the world around us, whether we think we are or not. And certainly that can fall onto surfaces, and people can touch those surfaces and then touch their eyes, nose, or mouth, and then inadvertently infect themselves. So even if someone is infected and has minimal symptoms, they're still able to transmit this infection to close contacts as well.
Next, can I look after my daughter's dog without worrying about, infection from the dog or infecting someone in my family?
I think we've got to be careful about this. We're not shaking each other's hands. We're not going around giving each other high fives. I remember when the NBA stopped doing that before the NBA was canceled. And, the more hands that touch a dog, the more opportunities there are to transmit infections. Now, of course, dogs and cats and pets need love. They need to be pet. They need to be cuddled. But, it's probably best for as few people to do that as possible, just because we could likely transmit the infection. It could get on the fur of the animal, and then it could be transmitted to another person that way.
Okay, last question, everyone. Is there anything the public can do to help make sure that health workers have the proper protection that they need? Dr. McCready?
If people have personal protective equipment that is new or unused, then a lot of places and hospitals would love to have it. And I think the second part, we need everyone to take physical distancing or social distancing extremely seriously.
All right, Dr. Bogosh, Dr. McCready, thanks both of you very much.
Thank you.
Thank you.
As we've mentioned, we'll be asking your questions about COVID-19 every night going forward. So send us the questions you have. We know you have a lot of them. You can message us directly on Instagram at CBC The National, or you can send us an email at thenational@cbc.ca. Next on The National, an urgent appeal to consider liquor stores essential services. Long lines and panic buying when PEI closed its stores. So we look at the health concerns at play here. Next. Plus.
It all seemed like a movie at first, like it wasn't really happening.
Who better to give us a pep talk for a pandemic? Mark Critch's message to Canadians. Just ahead. Welcome back. Today, the government of PEI reopened one of its liquor stores after all liquor stores were deemed non-essential services and shut down, leaving some worried about the consequences. Kayla Hounsel explains.
This is what happened when Prince Edward Island announced it would close government-run liquor stores.
I'm disappointed in Islanders' response. Alcohol is not
considered an essential service.
But those who live with alcoholism say it absolutely is. Carol Arsenault has been sober for 4.5 months.
If I had not had doctors and nurses there with me, monitoring my vitals and giving me the medication I needed, I could have had a stroke, a heart attack.
I think I was not clear yesterday. And
PEI's chief public health officer later apologized and today reopened one liquor store. But in Newfoundland and Labrador, the doors remain shut with telephone and online orders available. Ontario, Quebec, and Nova Scotia are keeping liquor stores open, at least for now.
There are, quite frankly, those Nova Scotians whose health requirements need access to this product. And we also know there are family situations where people are living in very difficult circumstances, whether it's domestic violence or abuse, that the restriction of this product could escalate that.
Addictions experts underscore the serious health implications of withdrawal.
We will see an increase in death if they are closed down, and we will see services for people with alcohol addiction become overwhelmed and overrun.
ERs, too, could be overrun.
People may turn to non-beverage alcohol, even when the non-beverage alcohol, starts to disappear, like it is here with hand sanitizer and things like that. People then turn to even more riskier forms of non-beverage alcohol, and we saw examples of that in SARS, where we saw people consuming things like antifreeze.
I just hope the government makes the right decision, and not just for alcoholics, but for everyone else in this province that's in line, maybe, for one of those acute care beds, and they may not be able to get one.
Arsenault and addictions experts agree now is not the time to judge, but instead offer empathy in the safest way possible. Kayla Hounsell, CBC News, Halifax.
Next on The National, a message of hope and a little laugh, of course, from Mark Critch. Plus, a first dance in the age of COVID-19. Their moment ahead in tonight's moment. But first, you've seen their faces every day for more than 2 weeks now. They are Canada's chief public health officers, and they've become new kinds of unwitting celebrities during this crisis, inspiring t-shirts, fan accounts, even a song or two.
Dear Dr. Bonnie, what to say to you?
Dr. Hinshaw's bomb, she's got it going on.
Some even want to dress like them.
Alberta's chief medical officer wore a smoking lily dress. Our email box went insane.
That dress is now sold out, in case you're wondering. So during these uncertain times, they have become part of our routine, giving us the facts and reassurance that we'll get through this together, which is the kind of celebrity power we can all get behind. For many healthcare workers, this pandemic brings up painful memories of the SARS crisis, but there are also new lessons and warnings about the patients who may fall through the cracks. Here's Nick Purdens with One Doctor Story.
Disinfecting after every patient is the new reality for Dr. Javed Alou. Alou is a family doctor at a busy clinic in Toronto. And as a frontline worker, he knows he's high risk for COVID-19.
It's hard to accept that we actually might be at more risk at a higher level than the average general public who can afford to stay away. We can't. Every day we're back here.
Dr. Alou knows that's part of the job. He worked during SARS. In fact, that's how he ended up in this clinic.
The doctor that I replaced was a victim that he died from SARS. And he caught it from a patient he was taking care of. So that's the reality. But you're a natural.
Alou was just out of medical school when SARS hit. He was asked to fill in at this clinic. 3 of the 4 doctors were hospitalized from the virus, one of them in critical condition.
And one day the nurse came in crying and saying he's passed away. And so we all knew that the person that they actually had been working with for so long, who had been taking care of patients with them alongside every day, wasn't going to be coming back after SARS. And it created a strong bond between the patients that I inherited. And this is a relationship that's lasted till today. This is something that actually has brought us together, recognizing the common humanity and the risks that we take together in actually getting care when we need it and giving care when we can.
They just told me that my office is officially closed.
So now when Dr. Alou meets his patients, like Maria DeMurl, he remembers a lesson he learned during SARS, when he had a near miss he'll never forget.
And I remember this one man, and this is the first time I met him, and this is right at the peak of SARS. I did his annual checkup, his physical examination, something we would routinely not want to do right now. We're deferring them during COVID for a later time, saying, hey, you're well, let's leave that assessment for later. And during the examination, I realized he had cancer. And so there I was wearing full gear with the mask, the gown, the gloves, the most barriered way of humans talking about something this horrible. And I had to tell him, hi, I know we just met, but I think you have cancer. And then I had to plan for him to get his care.
The man had his surgery 3 days later and survived. He's still one of Dr. Alou's patients today.
I don't know if he realizes every time I see him or his family, I remember what he went through during that time. And right now, it actually makes me worry about the people we won't be taking care of because we're so worried about COVID that we're going to defer their care. Who won't we save? Because we're so distracted by COVID right now.
17 years since SARS, that's an important lesson to help us today. Nick Purdens, CBC News, Toronto.
The moment is up next, but as we go to break, we're hearing it from officials and from our neighbors. People must stay home right now to limit the spread of this coronavirus. But being apart doesn't have to mean being alone. As Mark Critch of 22 Minutes reminds us, Canadians are resilient. We are problem solvers, making the best of this strange situation, one act at a time. Here he is for The National.
Back when this whole pandemic thing first started, my wife tweeted, "To avoid contracting coronavirus, don't touch your face. To avoid contracting coronavirus panic, don't touch your Facebook." She couldn't have been more right about how wrong everything was suddenly going to seem. Everyone I knew was split into one of 2 camps. Either they thought COVID-19 was no big deal, or they thought that this was the end of the world. It all seemed like a movie at first, like it wasn't really happening. And Tom Hanks got it, and we all went, "What? COVID? Not cool." Then Sophie Gregoire Trudeau got it, and we all went, "What? How? Really?" Remember the good old days? I don't mean the days of concerts and restaurants. I mean the good old days of teacher strikes and railroad blockades, back before a package of toilet paper cost more than a barrel of oil, and when a tan made you look healthy, not like you might have the snowbird flu. I started limiting the number of people I'd meet up with, just 1 or 2 friends at a time, as we FaceTimed a couple of other friends and make it feel like we still had friends. It's frustrating, but the best thing we can do right now is nothing. If we self-isolate, we can beat this thing. You just have to remember that isolation doesn't have to mean that you're alone. Our seniors, often our most ignored citizens, have been on lockdown. Many long-term care homes have been forced to close their doors to visitors, so one decided to open up their windows. The North Pond Manor in Torbay opened a FaceTime window so residents could get a little one-on-one time with their loved ones. This is a unique time in our history, and you have a chance to be a hero, not by running into a burning building or pulling someone from a pool, but by staying home and letting the real heroes do their job. For the past few nights, people of Vancouver have taken to their balconies and windows to applaud healthcare workers when their shift change happens at 7 p.m. Our artists are usually some of the first people we turn to in times of tragedy. They put off benefit concerts and they raise money and our spirits. But most of the artists I know have had months of gigs canceled due to this outbreak. So what did Alan Doyle do when he found himself with a new album at the top of the charts but with nobody to play for? He went busking on Facebook for Kids Help Phone because, let's face it, not everybody has someone to talk to. Every night, thousands of people tune in for a supper time sing-along. He's raised $20,000 so far. We may be separated right now, but the only way we're going to get through this thing is together. As isolated as we are, the best thing we can do is to remind each other that we're not alone. Take care of yourselves and each other.
Josh and Anastasia's wedding plans were disrupted, of course, in the midst of coronavirus, so they kept altering and shrinking their plans until finally the wedding could only include their closest family. So the rest of their friends had to get a little creative with how they could celebrate the newlyweds, and that is our moment.
We got into our limo, headed down to the Osprey Village there.
And as we started approaching, we're like, we know that face. We know that face. We know that face. And then we just like started realizing those are our friends from church that we could not invite. And they just lined up on the streets. They were in their cars. They kept the social distance and they were just honking and cheering and laughing and screaming.
Some of them made like handmade signs. They had like sparklers from previous weddings that they were at.
Then one of their friends were just like, you guys should have a first dance. And we're like, no, we weren't planning for a first dance. Like, we've already canceled everything.
They all just basically all just turned on the radio to the same station. Cars and people just lining the street. And there's us just in wedding dress and suit dancing in the middle of the street.
It was so great.
It was like the world's best surprise party.
Yeah, no kidding. So it's certainly starting to feel like we're all living through what will one day be a pretty thick chapter of a history book. And here's hoping a couple pages are reserved for the creativity and kindness. That is The National for March 25th.